Tethered oral tissues, that's a term used to describe the frenum attachments that connect our oral tissues. So it could be lip, cheeks, or tongue. Everybody has frenum attachments, and everybody is on the spectrum somewhere of some level of restrictions. I follow the Breathe Institute methods of measuring, and we like to measure, from a tongue perspective, the ability to lift the tongue in the front and the back as a ratio of how wide you can open. And we also like to monitor the compensations. Those should be addressed when we have a functional issue. So if, for example, the tongue is not able to do the tongue's job without the assistance of other muscle groups, then we'd want to look into why. So the first step would be doing myofunctional therapy and making sure that we have the strength and the knowledge of what the tongue is supposed to be doing. If for some reason we hit a plateau with our progress with myofunctional therapy, that's when we would involve someone like me to look at the structure and the anatomy to determine if we want to do any kind of procedure or release and to help with the tension of those oral tissues. Understanding the function of the oral tissues is paramount because that's the whole reason we would do a procedure. We don't do a procedure just based on how something looks. If we did that, we'd probably overdiagnose, and we really wouldn't be doing this for any purpose that would be helpful. It's important that we have predictable and good outcomes, and the way that we get that predictability is by involving the therapy. So it's kind of like if you were to have some kind of joint replacement. So if you go for a hip replacement with an orthopedic surgeon, they're going to prescribe physical therapy for you before and afterwards so that you know how to use your new hip, and so that you can strengthen the muscles around that area that was worked on. It's a similar idea. We want to rehabilitate the tongue afterwards, and we want to prepare the tongue in advance to be strong enough to undergo the procedure. It's also important because our work is much more predictable when we have that myofunctional therapy on board. All of the vital structures of the tongue are away from where we're working when that happens, so we can have a safe and predictable procedure. Tongue ties are really important for facial growth and development because just the act of swallowing is what forms our jaws. So we swallow about 2,000 times a day. The pressure that we put on the roof of the mouth when that happens is what forms that spreading motion to create the shape of the jaws. We want the jaw to basically be an imprint of the shape of the tongue. When children or infants are young, the bone is very soft. And so that pressure from the muscle movement completely forms that anatomy. So I tell families that the tongue forms the jaws and the jaws form the face and the airways. And so we want to make sure that the tongue function is healthy early in life so that that anatomy is growing to its potential. The consequences of not addressing a tongue tie can be numerous depending on the age and the situation, but some of the things that we can see are, first of all, dental crowding is one of the consequences of unaddressed tongue ties, and that crowding can lead to other issues. As we know, the crowding of teeth is not really about the teeth. It's actually just a symptom of underdevelopment and other health problems and dysfunctional breathing. And so while of course we can address the crooked teeth, we want to make sure that we're addressing whatever that root cause was. So if we're not able to breathe well through our nose and that's why the crowding happened, let's address that. If it's because of a tongue tie and that led to the dysfunctional breathing, let's address that. We do those releases for a functional goal.